Okay, how are you? My name is Nicholas and I work for an organization known as KAWE. Now at KAWE, we facilitate the improved quality of life for people with epilepsy, and we make sure that these people live their life just like any other person. Yeah, so basically what we do is that we create awareness to the community and we make sure that they understand that epilepsy is a disease just like any other disease, and people with epilepsy also have a right just like any other person in the society. So mainly we focus this information to community health workers. We work with the chiefs and the Nyumba Kumi initiative. Basically what we do is to make them understand that this disease is not as a result of witchcraft, it's not as a result of being possessed by demons, and it can be treated just like any other disease. So basically after they understand that, they will come to our facilities and they will get the help that they really require. Yeah, so in that perspective we create awareness to the community. We also go to schools, we also go to churches, and we also go to prisons. Yeah. After creating awareness to the community, these patients are supposed to come to our facilities. And when they come to our facilities, we don't want a situation where they are coming and the medical personnel in the facilities don't know how to manage them. So what we do is we do training to healthcare providers within the facilities. And this is the guideline that we basically use to manage these patients. Yeah. So after training these medical personnel, we make sure that they have to do proper data management, so that after making that data, the county health management team will use that data to do what we call budgeting for patients with epilepsy. After this budget has been done, it goes to the county assembly. So we also go to the county assembly and we advocate for medication and other services for epilepsy to be available in health facilities. And how do we do that? We talk to the members of the county assembly, the MCAs. So currently we've done an MOU, Memorandum of Understanding, with the county known as Tarakanidhi. And in Tarakanidhi, after signing an MOU with them, they adapted our MOU and now they are providing these services to their patients for free. Now, yeah, so basically after that we go to schools, because most of our patients also are chased out of schools the moment they get seizures, because it's assumed that they are demon possessed, and that causes our patients not to have the right education that they are required to have. So when we go to schools, we tell them that this is just a disease like any other disease. These people are supposed to be allowed to get on with continue with their education just like any other person within the society. Then after informing these people that this disease is a disease that can be treated, they are allowed in institutions. They get to the employment aspect. When they get to the employment aspect, some of the employers will chase them out of their jobs after they get seizures. So what do we do in that point? We go and train employers also that this disease is just a disease like any other, and when these people are having a seizure, after the seizure they can be allowed to work just like any other person. So when that happens, we are able to maintain these people within their workplaces and they are able to sustain themselves financially. So there is also another group that are not employed. In this group, they are also supposed to be self-sustainable. So what do? We do trainings for them. And the trainings that we do there for them is basically to help them sustain themselves. Like I have a product here. This is peanut. This peanut was produced by one of our patients after going through our training on how to make it and how to brand it and how to package it. So this is a person who is able to sell this product and is able to sustain his life the way any other person is supposed to sustain his life. The prices for this peanut is 1,000 shilling. The 1,000 shilling, part of it will go to the person who produced it, and the other amount will go into keeping a child with epilepsy in school. So that is why we are doing all this campaign, to make sure that our patients are well catered for and they live just like any other person in the society. We also have books here, and most of these books are used in what I've talked about. We go to primary schools. When you are going to primary schools and secondary schools, we go with these books. Basically they are comic books. The comic in it is explaining all about epilepsy. So we use the language that these people will understand easily. Yeah. When we go to secondary schools, we also have another book that we go with. So it also has pictorials and it has information about epilepsy. This helps them understand epilepsy in a language they understand. We also have another book here that we use when we are in the community, when we are talking to community health workers, when we are talking to chiefs, and when we are talking to the community at large. In this section, you'll find that we have pictorials and writings, so that we handle both people who can read and write and those who can also not read and write, so that no one is left out. Yeah, so basically that is our strategy. We are planning to go to different counties. Right now we've done 2 counties. We've done Tharaka-Nithi and we've done Machakos. We are planning to do all the counties within Kenya, but our approach is to work with the economic blocks. We have 6 economic blocks. After tackling the economic blocks individually, then we will spread to all the 47 counties eventually. So basically that is what we are doing here. In case you have any question, you can ask now.
Yeah, that's good work.
Yeah, thank you very much.
What about this?
Yeah, the bottles here go for 500. These are also, the printing on it is also, and the branding is done by patients. And the funds also go to keep a child in the facility, and the other amount will go to the person who did the branding. Okay. Yeah, so we also have flyers here. These flyers have more information about epilepsy. We have the one in Swahili version, and we also have one in the English version. So in case of any information that you might want to know more about epilepsy, you can also visit our social media channels. We have a Facebook channel, KAWE, Kenya Association for the Welfare for People with Epilepsy. We have a YouTube channel, KAWE Kenya. We also have a TikTok channel, KAWE Kenya. And we also have a Twitter channel, Epicare. Yeah.
Thank you very much.
Asante sana.
Sina maswali.
Okay.